Welcome back, dear viewers, and now we host our first guest here. So when we think about a beautiful smile, dear viewers, we often focus on white, straight teeth, but the real secret, dear viewers, lies in healthy gums. They are the silent protectors of our mouths, and when we neglect them, we risk more than just our smile. Today, dear viewers, we'll talk about the importance of gum health, how to detect early problems, and the modern treatments that make care easier and more comfortable than ever. So dear viewers, let's all welcome Dr. Abdelkarim Alhallak, a periodontist and implantologist. Good morning, doctor. Such a pleasure to have you.
Good morning to you and good morning, Kuwait. Thank you for having me. It's a pleasure being here, and I hope this will be beneficial to all the viewers.
Inshallah, doctor. And it's really such a pleasure here for you to highlight this topic, since you know, many people now are just focusing on teeth whitening, but they do not know how to care for their gums. Is that true?
Yeah, it's true. The gums are unfortunately very neglected, and it can have some detrimental consequences in many cases, leading to gum diseases. Gum diseases are the 6th largest non-contagious disease in the world.
Wow.
Accounting to almost 10% in the whole world and 20% in Kuwait.
All right, dear viewers, really this topic is really important to know about. So doctor, how can someone know that they have an unhealthy gum and they really need to take care of it?
Well, the best way is in preventing it, first of all, by going to the dentist, having regular checkups every 6 months. That's the best way. And one alarming factor that one should really pay attention to is bleeding gums. When the gum bleeds, that's a factor that you really should pay attention to and seek help by your dentist. Other factors like swelling in the gum or redness, these are classical signs of inflammation that requires us to seek help by the dentist.
All right, doctor, really beautiful information there, and would love to more about your experience here in Kuwait and dealing with these advancements in treatments for gums. And how do people approach your clinic, and when they try to, or when you try, doctor, to explain to them about their gum health, do they experience something new for them?
Yeah, I mean, unfortunately, we're still in a phase where we're raising awareness about this topic. A large portion of the population are still neglecting the gum health. So we are educating, raising the awareness in the importance of the gums, who is the silent guardian in the mouth. The gums act as a barrier to protect the teeth and the jaw bones beneath, to protect it from bacteria. Neglecting that might lead to bacterial invasion, and in worst case, it might lead to tooth loss.
Wow.
Yeah.
And really, to be honest, doctor, I really don't know anything about gum health, and you're explaining it really well, and also for our dear viewers here. They would love to know more about the health effect that the success of these dental gum treatments, and how does it really affect them in their teeth treatments?
Yeah, the gum health has very strong links to the general health, and many studies have shown the links between gum health and the health of the heart diseases. The invasion of bacteria in the gums might reach the bloodstream.
All right.
And by that also reach the heart and cause, in worst case, heart attacks.
Wow.
It's also linked to diabetes. Diabetes can affect the gum in a negative way, and the gum, when it's diseased, can also cause the diabetes to be uncontrolled.
All right. You know, doctor, this is some really new information here at Good Morning Kuwait for our lovely viewers. And you know, dear viewers, we really like to take care of your health. That's why we have Dr. Abdelkarim Alhallak here to explain to you all kinds of things. So, doctor, how does stress and diet and the lifestyle also come in the gum health section?
Yeah. The stress, first of all, I mean, lowers a person's immunity. That will lead to the bacteria more easily able to infiltrate the gum tissues, which would lead to gum diseases and inflammation and infection. Considering the lifestyle, one of the most serious factors that causes gum diseases is smoking and vaping. Many people are still unaware of that and think that smoking only affects the teeth and their color, but it's actually very damaging to all the structures surrounding the teeth. The structures surrounding the teeth are the jawbone and the gums. Smoking would cause harm and resorption of these tissues,
Yes.
and that's irreversible damage.
All right. You know, doctor, sometime when I went to a dental clinic, he told me that if you leave smoking while you're doing the teeth whitening, just leave smoking for 2 weeks and just go for the vape.
Yeah.
I think that's a rumor or it's a myth, like as you mentioned right now.
I mean, doing bleaching, here the doctor is talking about leaving the smoking for the sake of bleaching. So you achieve the white teeth, but it will
Yes.
still, going back to smoking later will harm all the tissues and structures surrounding the teeth. Even though if it's vaping, that is also very harmful for the tissues surrounding the teeth.
All right, lovely awareness message there, dear viewers. You really want to experience from Dr. Abdelkarim here so you can have a healthy life and also some healthy gums. So doctor, from your experience, what are the most common mistakes done by people that neglect gum health?
Yeah, the first of all is neglecting it and not going for regular checkups at the dentist's office. If you go for a regular checkup, he will discover the problem early on and help you and treat you so that it doesn't turn into a serious problem. Another very usual problem is taking too much care of the gums, and it might sound surprising, but brushing too ambitiously and too hard places pressure on the gums and causes recession of the gums. So you might see the teeth might appear longer than they should. Here we advised the patients to brush gently, ask your dentist how to brush your teeth, what is the proper brushing technique, use a soft or ultra soft toothbrush, and do not neglect brushing or cleaning in between your teeth. And for that we recommend, other than the flossing, using a water floss that is very gentle on the gums, or using interdental brushes. There are small tiny brushes that fits right in between the teeth that we can use, and these are very effective in cleaning in between the teeth.
All right, and doctor, you mentioned these toothbrushes that come in, like, as you said, ultra soft, soft and medium, and also hard. What would you recommend for a person who goes for hard, for example? Why does he go for hard, or how should he go for ultra thin? What's the difference in between?
Yeah, first of all, don't go for hard because it's very harmful for your teeth and your gums. I would recommend using an electric toothbrush and let it do the job without applying any pressure. Place the electric toothbrush on the tooth and move it gently along the surfaces of the teeth. That is what I would recommend.
Beautiful advice there, doctor. And as you know, our dear viewers, they really love to go to the co-op and just buy random things without even knowing.
Yeah.
And so for people who actually have some gum disease or unhealthy gums, and they are in fear of surgery, how would you advise them, or what would you tell them about the surgery that happens? Is it painful? Is it not painful?
Well, first of all, there is no pain at all because we apply local anesthesia that numbs the whole area, so you will not feel any pain. Second of all, the modern techniques that we have, the approaches that we have, for example, laser therapy, microsurgical instruments, all these techniques makes the procedures less invasive and makes the healing faster and the bleeding less. So these procedures today are very, very friendly and gentle, and they're not scary. Many people are shocked after they've gone through a surgical procedure.
All right, and you know, doctor, I really fear the dentist from the injection to the mouth. It really hurts sometimes. I don't really like that.
Yeah, well, even that, I mean, we have topical gel that numbs the area so you don't feel the prick of the needle.
All right, all right. What about that, dear viewers? New technology in medicine for your beautiful teeth here. So, Dr. Abdelkarim, also would love to know, like, is there a link between inflammation and the gums, and what kind of inflammations happen before diabetes or before something really serious happens? How can a person know that he has something with his gums?
Yeah, as we mentioned, the most important factor to notice is bleeding in the gum. If the gum bleeds, then something is wrong. Maybe it hasn't turned into something serious, but it's going there. So please seek help from your dentist. Another important thing is that we notice in pregnant ladies, the spikes of hormones causes gingival or gum swelling and gum bleeding, and that sometimes makes the pregnant lady scared of brushing her teeth because it causes bleeding. So don't stop brushing your teeth. The bleeding is normal. If you stop brushing because of the bleeding, it's only going to get worse.
All right. Thank you so much, Dr. Abdelkarim, for being here on Good Morning Kuwait and explaining all kinds of your experience here for our lovely dear viewers.
Thank you very much.
You're most welcome, Doctor. So, dear viewers, what about that? We'd all like to thank Dr. Abdelkarim Alhallak, a periodontist and implantologist, for being here on Good Morning Kuwait. Thank you so much again.
Thank you too.
Therefore, dear viewers, we shall take a quick break and we'll be right back. Please stay tuned.